The best personal statement I ever read was one that opened with, "I woke up once again in a field of 1,000 sunflowers." And I was like, that's really interesting. And then it was this whole story about growing up on a sunflower farm in the middle of North Dakota or South Dakota. I still remember it to this day. Matched that person, which was really cool. So storytelling is like an interesting thing if there's like something unique. So it was great advice. So I'm Dan Egan. I'm the program director at the Mass General Brigham program in Boston. And I'm here to talk about how to find a mentor. So I guess I'll start by just saying that I think of where I've gotten in my career to be completely related to the mentorship that I've had along the way. And many of the opportunities that I've gotten along the way are because people who were amazing mentors to me kind of offered me a chance to do something, or invited me to be part of a committee, or mentioned that there was an opportunity to think about getting a job somewhere. And so this is a really, really critical part of medicine, particularly if you're thinking about pursuing a career in academic medicine, which I imagine many of you are, given that you're here at the academic emergency medicine meeting. So the first thing that has to happen when you're thinking about mentorship is to do a little bit of self-reflection and to think about, what are you looking for a mentor to help you with? And there are a lot of different things that we look for mentorship for. We're going to think about professional development. We're going to think about potentially research or scholarship. We're going to think about decisions related to where do you want to train. There could be mentorship related to people who have shared experiences to you. And then there's also this whole other sort of subgroup of people that really just are kind of fitting more in an advisory capacity. Like somebody who's just like, you're going to meet, I feel like I have a lot of advising meetings with students who they just want to run their list. They want to talk through some questions, just like some targeted little like one-time meeting. We don't need to have a long, there's no long-term relationship. It's just those meeting ones, and that's it. And that's very different from mentorship. I was like, what's going on? I'm like, somebody's talking about.
Somebody found a mentor.
Yeah, exactly. Congratulations. You're welcome. So I love this analogy, and I think this is really important, particularly as you're just starting out. This phrase I heard one of my colleagues use in a talk that she gives, Dr. Adara Landry. Some of you might see her on Twitter. She does a lot of mentoring things. She talks about the fact that it's really important to realize that you're going to have more than one mentor in your life. You're going to have lots of different mentors. And in fact, you should think about your group of mentors as your own personal board of directors. And if you think about what a board of directors of an organization is, there's a president, there's a secretary, there's a treasurer, there's like the bylaws committee, there's the members at large. Each of those individuals has a different role, but they're all serving the same purpose of advising an organization. And so in your case, you're going to start to figure out, I'm going to have a mentor for this, I'm going to have a mentor for this, I'm going to have a mentor for this. All of those people collectively are advising you to get you to where you want to be and for your success, but each of them is bringing something different to the table and to the conversation. And so you should be welcoming the idea and the concept that you're going to have many people who are engaged in your career planning and in sort of your discussions about what you want to do. So there are also, I'm going to take us through a couple of different sort of ways that you get mentors. There are things that are going to just happen just by the nature of being a student and being in school and going through rotations. And I would say that at your institutions, or if you're not at an institution that has this, but other types of events, your EMIG group or something like that, where you're going to have the opportunity to interact with faculty members monthly or however often they meet. And this is just like an open door invitation to find faculty members who may potentially ultimately serve as a mentor for you in a situation that is just presenting itself to you. They came to do a talk on a topic. You're sitting around a table. This is actually a picture from one of our EMIG meetings. And that's one of my colleagues who's at the table. And afterwards, they just started hanging out. And the students started talking to him and asking questions. And ultimately, that just opens an opportunity for a mentorship relationship to happen. But I would say that there's a lot of things in medicine. You're entering into the next chapter of your life where the kind of secret of medicine is that a lot of what you do is because you're self-promoting yourself and you're motivating yourself and you're finding opportunities yourself, as opposed to going through school and you get a syllabus and you know what's coming next. Now it's kind of entering into this professional category where you have to figure a little bit out on your own. and to make some inquiries on your own. And so finding mentors is actually one of those things that has to be a little bit self-directed. This is an opportunity where someone's just going to kind of show up and they're going to be there and you could potentially interact with them. So what are some ways and how do you do that with other people? So along the same concept of this personal board of directors, you will need mentors for different times in your career and in your life. And one of, I think, a really important concept in one category of mentors are kind of near-peer mentors. So if Emra, I think Emra still does this, but if not with Emra, but within your own school, within your own EMIG group, I can't really be a great mentor to you on what it's like to be a student going through a virtual interview experience. I can be a good mentor to you and tell you what it's like from my optic as a program director of how I've navigated this new space that we're in. But somebody who just lived this experience and went through this process is going to be a great near-peer mentor or peer mentor for you about that. And there will be similar situations. If you're a new faculty member, when you get your first job, talking to someone who recently joined that group is a really great, near-peer mentor, particularly if you're coming from a different type of practice setting, or you want to make sure that you are speaking to a woman in that department if there's not a lot of women. So there's many different scenarios where that real close contact with somebody in close proximity to your stage of training or career is really important. I was like, what do I say about Elon Musk when I put the Twitter slide up? I'm not, but you know what I'm thinking. So this is just a way to say that social media has really changed I would say, the accessibility of mentors. And you can get passive mentoring just by following certain people and what they post. But you also now have the ability to kind of access people a little bit easier than potentially you have before. And I've not infrequently gotten direct messages on Twitter from somebody who has a question, and I know many people who have established really meaningful professional relationships and some mentorship relationships because of interactions on social media. And so obviously using it appropriately and carefully, but this really has opened the door for you to be able to even find international mentors that you maybe would not have interacted with or had the opportunity to meet with in person. And so I would encourage you, even if you're just doing it for the passive mentorship, but just seeing what people are saying, what they're talking about, referring you to articles, referring you to other people's lectures and things that will potentially help to inform your career development. You're all here. So this is, to me, positively predicts what your future is going to look like, as you're already really motivated people who've come to a meeting like this, and you're literally surrounded by potential mentors. But of course, as I imagine, as a student, and I remember what it was like as a student, it was increasingly longer and longer time ago, unfortunately, it can be intimidating. But it's not necessarily about walking up to the person that just gave the keynote, but it is potentially about the next time you're maybe in a smaller setting, or you see them in the hallway, or you see them in the room, and you say, hey, I saw you give that talk on how to find a mentor. It was amazing, and thank you so much. And you've just broken a barrier, right? And it's like you have a shared experience. You sort of talked about something common. But I heard you give the plenary on diversity, equity, inclusion, and justice. And I was really moved by that. I'd love to have the opportunity to speak with you or something. And people relate really well to you having seen them speak or heard them do something or know of their work. And sort of bringing that into the conversation is a way to just sort of start a conversation that might have otherwise been difficult to start. So as you're deciding who, one of the pieces, this kind of gets back to that self-reflection thing, is which door are you going in? Who's the person you're going to ask? And you really have to decide what is the focus of this mentorship relationship. So do I need a research project, and am I really interested in stroke research and I want to meet somebody and get involved in a project? So that's going to be a path. Or, you know what? I'm a gay man in medicine, and I really need a mentor who's shared that lived experience that I have had, and I want to find somebody that's going to help me grow and develop and understand sort of the challenges in that space. Or I'm a woman in medicine, and I really want to have a strong woman mentor that I can relate with. Or I want to be an educator, and I want to meet an educator. So what is the appropriate person? What is the need? Because it's really important to go into these conversations with an agenda, as I'll talk about, and sort of knowing exactly what you expect and what you're trying to gain from this experience. And the very first thing is that the person should be somebody that you respect. That seems pretty obvious. But this should be someone that you could see yourself emulating based on what you've learned about their career, somebody who seems to be successful in the space that you're interested in, somebody who other people respect because clearly that speaks to their ability to relate to others. So they're doing what you're doing, or they have sort of a job description that sort of fits with what you need, and somebody that others respect. And the other thing is that you should do your homework. Not everyone is a good mentor, right? And it's not necessarily because they're bad people, but some people are just really, really busy. And to be a good mentor takes a time commitment. And so you should ask your colleagues, your peers, the students in the classes ahead of you. Ask the people in your student affairs office, is that faculty member known to be a good mentor for students? Are they approachable? Do they respond to emails? Get a sense of who this individual is before you invest a lot of time of yourself to sort of setting up this relationship that may ultimately go nowhere. So do a little bit of homework and kind of inquire about who are the people that are very student-friendly in your institution, or potentially outside of your institution if you have access to that. And then it's this fine line in medicine of kind of like the balance of how aggressive are you in pursuing this mentorship relationship. So medicine and having this professional career requires that you kind of assert yourself and sort of attempt to get things for yourself, right? That's kind of what we do. But you don't want to go sort of on the extreme and kind of be in the annoying category. And so it's sort of navigating that in a very professional way, which all of you obviously know how to do, and figuring out how to communicate in a way that's going to make someone want to work with you. And so one of the things that I think if you're doing an introduction by email, which is often the way that we do these days with everything, unless you happen to run into somebody in a meeting, you kind of just say, hey, this is who I am. This is what I'm looking for. I'd love to have the opportunity to set up a meeting with you. And then the other thing you can throw in there is you can give them an out. If they don't have the time, they might and probably do have a colleague that may have the time that they know, now that they know what you're interested in, they could refer you to, right? So, hey, Dr. Egan, I'm really interested in pursuing a career in medical education in emergency medicine. Love to know if you have the time to talk. Now, if you send that to me when I've got like my 3 weeks of screening applications, I'm going to say I have no time for this. But hey, let me introduce you to my clerkship director. We can start there and we can circle back and meet maybe in a couple of months. And it's just a totally mature way to approach that conversation. The next thing is that you want this to be successful because you're trying to do this to gain sort of some knowledge set or some expertise. And the way that you're successful is by also being a good mentee. So it's not just about the mentor being a good mentor, and you'll get that sort of opinion from others, but also being a good mentee. And being a good mentee means being responsible, having a plan, being really clear with what you're looking for, and following through on things that you discuss in your meetings. And particularly if you're doing mentorship in the space of projects, either a research project or trying to write a paper or trying to get something off the ground, being someone that is reliable is going to make that person just have such a more positive opinion of their experience of working with you. And so that success is also really hinges on this idea that you have to have shared expectations of what this relationship is going to be. And so, if someone comes to meet with me and my meeting goes something along the lines of, I'm planning on applying to EM next year. These are the hiccups that I think are in my application. I need some help with figuring out where I should do my OA rotation. And then I'd really like to talk about kind of what programs you think I should apply to. And then I'd ultimately like to come back when I'm getting my interviews to talk through if there are some I should cancel or not, and then maybe my rank list. So that person has now just told me what their expectations are from that meeting. And this literally just happened like 3 weeks ago. And I was like, okay, perfect. So here's what I need to know from you. I need you to be fully transparent with me and tell me what those hiccups are so that I can really be well informed. We need to set a timeline, and we're going to have a list of places you think you want to do your rotations that you're going to get back to me in 3 weeks so we can talk again. And then we're going to set up a meeting for September so that we know that your list for where you're going to send your applications is appropriate. And then we're going to have a touch point. And so now they know what I'm thinking, I know what they're thinking, and then there's no ambiguity about what this relationship is. I know that I'm going to have another follow-up meeting with them in about 3 weeks, and then I know I'm going to meet with them again in September, and then I'm probably going to have a touch point with them in January. and then hopefully have a celebratory meeting after the match. And so we know what it is, and I'm not questioning it. And similarly, especially with projects and other things, what do you expect my role to be? How will I be most effective to help? And to just be respectful of that and really set that clearly from the beginning. This one's important. This is really just to talk about time. So everybody's busy, and you're busy, faculty are busy, people's time is really limited. And this is one of those things that's like, we do it because we love to do it, and most of us work in academics because we want to work with students and residents. I almost didn't say my residents as a program director. I want to work with residents. But it's not like something we get extra money for necessarily or something like that. So it's not, there's just got to be an innate motivation to do this, and so it has to be something that's not going to be like too much time commitment, but also fulfilling. It is helpful to faculty members to have mentors who are successful and go on to do great things, and we report that on our CVs when we go up for promotion. So there's definitely benefit to the faculty. So don't think that this is just, it is service, but there's definitely perks to having a lot of mentors or mentees who have gone on to be successful. But just recognize that they're, sort of on that red light, green light thing, like sending an email today and then I haven't had a chance to respond tomorrow and sending me a follow-up email to see if I've gotten your email from yesterday is like just not being respectful of my time. Maybe I'm in between overnights, or I had a shift last night that ended at 1 in the morning and I just haven't caught up with my emails yesterday. So just sort of being aware of that. And then I would just say before every single meeting, you should have a plan, because the truth about what will happen in most relationships is that the mentee will drive the conversation and the mentee will drive the agenda. If there's a project that's a little bit different in that space where there's like a need and you have an outcome and you're trying to get a study done, but for the most part, the easiest and most effective meetings for me as a mentor is when the mentee comes in and they're like, all right, these are the 4 things I want to talk about today, or these are the 3 things around my mind, depending on the sort of relationship that we have. And those are so much easier because it doesn't take a lot of prep on my time. This is not about me, it's about you. So you've just declared what's going to be the most beneficial to you for this time. And then I'm going to feel like I was more effective if we've achieved those goals that you defined before the meeting happens. And then the last thing is we do not want the world of ghosting that takes place in many other aspects of life to enter into this. So do not just drop off the face of the earth or sort of just be that responsible person. And hopefully similarly the faculty member will share that same respect in return. And that's all I got. I'm happy to answer any questions if you have any. All right.
No questions. That was great. Thank you.
No problem.
I think the other thing, just to think about is there are a lot of formal mentoring opportunities. And I know this is kind of loosely uses the word mentor because these are like forced pairings, but there's programs out there where you can get paired up with somebody. And I think if you don't have a person like that at your shop, those might be very important to you guys. And you're the people that are here taking advantage of it, but at the same time, make sure that you look into those opportunities
keep your
as
eye
well.
on. I didn't actually include it because ASAP has it on full, but like last year, for example, they piloted it was an ASAP diversity mentorship program that currently is on hold just for funding, it sounds like. But that was a great sort of formal thing. You just submitted information about yourself, what your interests were, and then you got paired with somebody. And I did that for like 3 or 4 people, and it was more it was formal but almost informal because it was just somebody from far away, and we just met to talk a couple of times. So things like that do happen, and I would pay attention to RAMS and EMRA and those other things because they will have opportunities like that, particularly for people that are from outside of the U.S. or places that don't have EM residencies at their own institutions.
Great. Thank you.
Yeah.
Thanks for coming.